Good afternoon, everyone. This is Pushpak, Occupational Therapist from Begumpet branch. Today, I am going to explain about auditory processing disorder, and this is my colleague.
Hello, I am Durga. I am a behavior therapist. I joined as a trainee in Pinnacle Blooms. So this is my first time here.
Okay, today I am going to explain about auditory processing disorder. So first, we'll try to understand what is auditory processing disorder. Generally, the kid with autism or ADHD and ADD will have problems with auditory processing, which happens at the auditory level of the brain. So the kid will not be able to process the information which is coming to him. So the kid, whenever you make it, give a command, or when somebody is trying to tell him that, something, the kid will not be able to concentrate on those things. So why this will happen? So the kid will be having the same auditory system as a normal person will have, but the processing which happens at the brain level will be different. So due to this, the kid will not be able to take the commands which is happening at the brain level. So whenever someone is giving a command, so the kid will not be able to follow it. So uh, the kid will not be able to follow the commands repeatedly. And the other type of things which we see in kids with special kids is the kid will not be able to concentrate on certain things due to having auditory processing disorder. If a fan is there in the room, and and you're making the kid to do some activity, if the kid is having auditory disorder, so the kid will not be able to concentrate on the activity. So instead of doing the activity, the kid will be concentrating more on the noise which is coming from the background, like the fan noise or the refrigerator sound, or maybe they can even note the minutest sounds like CPU processor. They'll be able to note that. So there are two types of things in this auditory processing disorder. One is over responsive, another one is under responsive. Those kids who are having over responsive will react more to the sounds, they'll seek more for the sound, like they'll observe minutest sounds which are there around them. And the other thing is under responsive, in which the kid will not notice those sounds which are around them. This will happen mostly with the hypo kids, those who are under responsive to these sounds. So they'll not be observing the environment around them. So we'll get to know why this is happening in the kids. Generally, when most of the parents come for the assessment for the Pinnacle Blooms, saying that we gave gadgets to the phone or introducing screen time. So the kid will tune into that gadgets or something. I wouldn't say every kid will do like that, but some of the kids will tune into that virtual world where they'll try to grab everything from there, and doesn't react when everybody is when someone is asking him to respond, like name calling response wouldn't be there, and they'll not give proper eye contact. So everything is related with either vestibular or auditory. So so due to this virtual autism, the kid will not be able to concentrate on things. And like in auditory processing disorder, uh, for the coping mechanisms, we have to especially in OT, what we'll try to do is we'll try to make the kid do different type of activities, like giving heavy activities which gives proprioceptive input, like putting the headphones and putting a heavy like putting calming sensory music, or some pleasant music. We can use white noise, as a white noise, which is a channel in which we'll put some rainfall or waterfall music, or some I mean like we'll also put some music of air, like these things will be using it. and we'll try to put that sound, and we'll ask the kid to do heavy activities like pushing or pulling activities, and like wheelbarrow walk or bear walk, knee walk, and we'll ask the kid to do heavy activities like climbing the ladder or lifting the bolster. So if we make the kid do these activities, the kid's auditory processing disorder, which will be there. Kid's auditory processing disorder, which will be there, it will get controlled. So along with that, so some of the parents ask me like, how can I take my kid to a concert or a mall where there is huge noise? So for this coping strategy, we cannot make the kid say no every time, not to jump while listening to a sound if he is seeking sound out more. So instead of controlling the kid, we can ask the parents of with special kids to use ear defenders, or like put ear mufflers, or put noise cancelling devices like headphones, so that the kid will be able to behave properly uh, in concerts or malls. So we cannot every time control the kid. So it's better we follow such certain coping mechanisms to make the kid follow, to make the kid like familiar with the environment, and make him socially acceptable. So along with that, I explain about tactile tactile sensitivity also. So what is tactile sensitivity? So there is tactile sensitivity and there is tactile defensiveness. So one who is seeking out more tactile input, I mean, like they'll try to touch everyone, or they'll try to rub their body on the walls, or like they'll try to like cuddle everyone. So this is like the tactile sensitivity. Tactile defensiveness means the kid will avoid the touch of the strangers or even the known persons, and he'll avoid clothing, and he'll avoid tight clothings. So for these kids, we can use a Wilbarger protocol, which is helpful for reducing this tactile sensitivity or tactile defensiveness. Along with that, we can give joint compressions and do burrito roll technique along with Swiss ball compressions, which would be helpful in reducing the tactile sensitivity. And we can introduce into different textures, because the kid is not liking a rough texture. So why he is not liking rough texture means maybe he doesn't know the difference between a rough and a smooth texture. So we can introduce a smooth texture along with the rough texture, and then we can gradually decrease the amount of time like of the rough texture, and gradually increase the time of the smooth texture. We like it will be like a 5 minute protocol. Like if you are giving rough texture for 4 minutes, we'll start introducing smooth texture for 1 minute, and gradually we reduce the time of the rough texture. We'll make it 1 minute, and we'll make the smooth texture for 5 minutes. In this way, the kid will get adapted to the smooth texture, and he'll get to know the difference between the smooth and the rough texture. So it doesn't mean like a kid is touching everything. So it doesn't mean that your kid is having tactile sensitivity. Sometimes it may be due to that kid might be exploring things around him if he doesn't know what is around him. So that doesn't mean your kid is having tactile sensitivity. Along with some kids might be having oral sensitivities as well. Like the kid will try to chew more, or like the kid will do teeth grinding. So in oral sensitivity, the kid will be wanting to do mouthing of things or teething of objects. So due to this, to reduce this, we'll in OT we do massage, gum massage with finger brushing, and we'll do some oral massages. Along with that, we'll do some massages for the cheeks, like we'll do this super like this, and like clockwise and anti-clockwise. So this will reduce the sensitivity. Along with that, we can use cotton balls in hot and cold, whichever the kid is avoiding. Like if he's having more sensitivity to cold, we'll do with cold, like we'll do with hot opposite one. So the kid will know the difference between the hot and the cold. So in this way, we try to reduce sensitivity. And if the kid is having sensory need, like to chew objects, This is like why the kid will do this is to regulate himself. The kid will do this is like a sensory diet to him. So instead of controlling the kid, we can ask the kid to give, we can ask the parent to give chew tubes, or there are certain things called jewelry. So for jewelry, we can there are different objects which we give, like wristbands or the one which come in the neck. So we can give them, and we can gradually reduce the time, like, or we can give a specific time for the kid to chew the time, like whenever he is having that need, we'll try to give it. So we cannot completely suppress every sensory thing which the kid has, as you know, it's like a lifelong condition. So we will like reduce sensitivity up to some extent, like it can be reduced up to 80 or 90%. Then the rest 10%, whenever the kid is having that sensory needs, we have to give that particular thing and then reduce it. In that way, the kid will be able to do his daily things. And along with oral sensitivity, we have some kids might be having uh, visual distractions. This might be due to the kid like the kid will be not able to concentrate at one place while we are telling him something, like if there is some colorful objects around him, so and you're asking him to do the activity, the kid will not be able to concentrate on that thing. So instead of telling the kid to do, we can remove that visual distractions and then make the kid do, or we can put some sticky notes like around his, like to the side of his eyes, and then reduce that visual distraction and then make him do. Generally, it's better those kids who are having visual distraction, we can ask them to take in the corner of the rooms, because the corner of the rooms will be very effective for kids who are having visual distractions. And make sure that the one which you want to teach, you keep only that object in front of him, so that he will not get visually distracted by the other things around him. So take one at a time and then teach him according to that. In so it would be better you take in a corner of a room and avoid, and make sure you are getting away from the windows or like the doors. Make sure that it is completely at the corner of the room. And there are other things called as visual stimulation. In this visual stimulation, the kid will be having uh, either he will be under responsive or over responsive. In one of the things, the kid will be attracted towards the bright lights, or he'll be seeing the spinning objects, or they will be playing with the toys of the wheels in the reverse manner. So, or either of the are like under responsive, the kid will be uh, not seeking the light, like he'll not be observing the things around him. So for reducing this over responsive, we can do dark room activities. We'll do inverted activity. And if the kid wants to seek more, like I did a 5 minute protocol for one of my kids where I showed torchlight through some through water bottle, and that will reduce the amount of light which is going to him. And I asked him to look at that for 5 minutes, and then gradually I stopped the light for 1 minute. Like in the 5 minutes, I used to show it for 4 minutes and 1 minute without any light. The gradually I reduced the amount of light which is seeking. In that way, the the visual stimulation which is getting, that got reduced for one of my kid. So along with that, we can teach. Generally, we want to make the kids self-sufficient, so we should also teach ADLs for the kids, like buttoning or unbuttoning, zipping and unzipping. And we can also teach the kids to how to wear their shoes, or sandals or chappals. So these are the essential things which we should teach for the kid to lead his life, which we will do in OT by using different materials. Like we have ADL kit. We'll use the kit and we'll ask the kid to do that, and in which we can teach different techniques to the kids, so that the kid will be self-sufficient, and he'll be able to do the things on his own. In one of the research, where we find that kids are not able to, the one with special kids are not able to learn these ADLs, and they're ending up their lives by the age of 21. So it's very sad to hear that. So it's like our responsibility to teach the kids about the ADLs and all, so that they will be self-sufficient and able to do the works and do not depend on anyone. And we have some other things called as proprioceptive and vestibular thing, in which the kid will not be able to concentrate due to this vestibular and proprioceptive sense. The kid will not be able to calm down, so he will not have no sitting tolerance, and the kid will be jumping around the place, and and the kid will not be able to concentrate on things while we try to say something. And this is related to auditory as well. So sometimes the vestibular and auditory both might be there in a kid. So due to that, the kid will not be able to concentrate. So for this, for vestibular and proprioceptive, we generally do vestibular activities like swinging, in which there will be linear and angular swinging, uh, where we do linear and angular swings for reducing the vestibular input. If the kid is hypo, then we'll try to do in a different manner. There will be circular swing also, which will increase the vestibular input to the kid. So this will increase the vestibular input and make him neutral. So our goal is like either hyper or hypo. We have to get to the neutral sense, where the kid will be able to process the signals which is coming to his brain, and able to respond to the people around him. And then so in vestibular and proprioceptive, we'll do in proprioceptive we'll do heavy activities like climbing the stairs, and we'll ask the kid to do, I mean, like different types of walks. There are different types of animal walks like bear walk, duck walk, crab walk, and there is elephant walk and army crawl. We'll make the kid do these type of activities and make him less hyperactive. And if the kid is not that active, hypoactive, then we'll make the kid to do all these activities and make him active. Both the ways we'll use the same techniques, but it depends on the type of kid which you're getting, and how you deal with it. Thank you. Like my colleague will.
So you explained it very well about the APDs and the sensitivity of tactiles and all. I have few questions in APD. Like what age it will be detected?
So there is certain age to detect this APD. So generally, around above 3 years, we can do CARS assessment, and in that we have something called a sensory profile. So in sensory profile, we have certain type of question. There will be questionnaire, and your pediatrician or like psychologist who is there, they'll ask those questions and rate the kid according to that, and then they'll see whether your kid is having APD or like other type of sensory issues. So according to that, you will decide whether the kid is. And like some kids, they'll try to those who are having APD, they'll try to close their ears while listening to high sounds or high pitched sounds. So while we do this thing, like we'll ask the parents like whether your kid is closing their ears, or like he's avoiding sounds of cooker whistles, or like general sounds like grinder or something. So in that questionnaire, there will be few things in which they'll get to know about whether his kid is having auditory processing disorder or not.
Okay. So what are the symptoms of this
So
APD?
generally the kid will close his ears when listening to high pitched sounds, or he'll try to jump more, like while if he enjoys that, if he's seeking more, he'll try to jump more while listening to the sounds. And in some type of kids, they'll do vocal streams also. They'll try to do certain type of sounds to seek it more. So these are the symptoms which we can see in kids with APD.
So for APD, what is the major cause for auditory processing disorders?
There is not any known cause for it, because still the research is going on. So we have to look into the research and then find out. But generally, there is this thing called as a processing disorder. As it's a processing disorder, which is not detected in any X-ray or MRI or anything. But there is some problem with the sensory part. So due to that, this APD is.
Okay, so these are all my doubts.
Pinnacle Blooms Network ప్రపంచ వ్యాప్తంగా స్పీచ్ డిలే, ఆటిజం స్పెక్ట్రమ్ డిజార్డర్, కాగ్నిటివ్ డెవలప్మెంటల్, సైకలాజికల్ రుగ్మతలతో బాధపడుతున్న దాదాపు 80 కోట్ల మంది పిల్లలు మరియు పెద్దల జీవిత ప్రమాణాలు మెరుగయ్యే విధంగా దశాబ్దాల రీసెర్చ్ తో కూడినటువంటి అత్యంత ప్రభావవంతమైన స్పీచ్ థెరపీ, ఆక్యుపేషనల్ థెరపీ, బిహేవియరల్ థెరపీ, సైకలాజికల్ కౌన్సిలింగ్, చైల్డ్ డెవలప్మెంట్ మరియు రీహాబిలిటేషన్ సర్వీసులు అందిస్తున్న ఏకైక స్పెషల్ ఎడ్యు హెల్త్ కేర్ సంస్థ పినాకిల్ బ్లూమ్స్ నెట్వర్క్. ప్రపంచంలోనే మొట్టమొదటిసారిగా మిరాకిల్ అనే పేటెంటెడ్ టెక్నాలజీ సహాయంతో అత్యంత పారదర్శక థెరపీ సర్వీసులను అందిస్తున్న ఏకైక సంస్థ పినాకిల్ బ్లూమ్స్ నెట్వర్క్. 100 మందికి పైగా నిష్ణాతులైన థెరపిస్టులతో మీ మరియు మీ పిల్లల బంగారు భవిష్యత్తు కొరకు పాటుపడుతున్న సంస్థ పినాకిల్ బ్లూమ్స్ నెట్వర్క్. భారత ప్రభుత్వ ప్రతిష్టాత్మక స్టార్టప్ ఇండియా అవార్డు పొందిన భారత్ హెల్త్ కేర్ ప్రైవేట్ లిమిటెడ్ యొక్క అనుబంధ సంస్థ.